I think it's really important for young women who are worried about their periods to seek information about what is heavy menstrual bleeding and to evaluate whether or not they may actually have a problem. Because with heavy periods, we can make things better. We have treatments that will decrease the amount of bleeding and make their quality of life better. When it comes to the barriers and challenges for von Willebrand disease diagnosis, I think the biggest issue is that it doesn't even get considered. That patients are having abnormal bleeding symptoms and aren't getting referred to hematology or aren't getting appropriate testing done. So we know that we're missing thousands of individuals in Canada who have von Willebrand disease, but who have never been diagnosed. And so those individuals are having bleeding that we could be treating. And so I think that's the biggest issue is missing the diagnosis. When it comes to VWF assays in Canada, we're very lucky. I think we have access to accurate assays, and I don't see that as the major barrier. I think the major barrier to diagnosis is that people's bleeding is getting overlooked and that they aren't even getting tested for von Willebrand disease. So there's so many examples. I see patients in clinic every day who've been suffering from heavy menstrual bleeding, and once we declare that and make a clear diagnosis of von Willebrand disease, so many treatment options become available and we can really improve their quality of life. So I have patients, their sisters, their mothers, their daughters, who across the board in the family, we've been able to improve quality of life. And it's really impactful and rewarding to be involved in that. I think for VWD patients, make sure that you're seeing a hematologist and a person who cares about the bleeding that you're dealing with because we have effective treatments available with new options coming on the horizon, and we certainly can do a significant, have a significant impact on making people's lives better.